Namaste. Good afternoon. This is Dr. Aparna. I am your emotional healing synergist. I am an Ayurvedic psychotherapist, a passionate infopreneur, edupreneur, and medical writer. I am in my pursuit to address, promote, and propagate Ayurveda and psychotherapy globally. In this discourse, I come up with discussions every week on Ayurveda, psychotherapy, mental health, and other related aspects. This session is a continuation session on uh, my mental health support, that is awareness series, that is bipolar disorder. In the last session, in the previous session, we had discussed about bipolar disorder. What is bipolar disorder? And what exactly happens in bipolar disorder? What are the symptoms of bipolar disorder, and what is the impact of bipolar disorder and on body and mind? Today we are going to discuss about the types of bipolar disorder and the full cycle of bipolar disorder and the treatment aspect of bipolar disorder. So, without wasting time, let's get started. See, for people who have not seen the previous episode, if you want to know in detail about what is bipolar disorder, I would want you to watch the previous session. But just for the recap, I'll tell you what is bipolar disorder. See, bipolar disorder is a complex mental health condition. That means it has episodes of extreme mood swings in the same person, including something called manic episodes that we discussed yesterday, that means highs, and depressive episodes, that means lows. So both highs and lows in the same person, extreme mood swings in the same person. So earlier bipolar disorder was also called as manic depressive disorder or manic depression. So yeah, that is a that is a serious mental illness that is unusual and has severe mood changes, mood swings. So the person may experience highs, that those highs are clinically known as mania, and lows, that is depression, so which may be persistent for few days or many weeks. The person may experience distinct episodes of mania and depression. So, and these episodes may switch rapidly, even multiple times in a week. So, a person with severe bipolar disorder may even also, have psychotic symptoms. This is in severe cases like hallucinations or delusions, and may even have thoughts of self harm or suicide. So, bipolar disorder can inhibit the person's ability to function normally in daily life and can result in damaged relationships, both professional and personal. So, there are several types of bipolar disorder, each with distinct features. And next we are going to know what are the types of bipolar disorder, as I said in the beginning. So, there is there are 4 or 5 types of bipolar disorder, which is, bipolar 1 disorder. What is bipolar 1 disorder? Is this types involves at least one manic episode, one episode of high lasting for at least 7 days or requiring hospitalization. Depressive episodes may also occur. That means the person will have a manic episode which lasts for at least a week, and maybe it requires hospitalization at times because of the severe highs, that is manic episode. And depressive episodes may occur or may not occur. So here it is not compulsory that in a bipolar disorder person or a bipolar 1 disorder person, depressive episodes, both the things might happen. So only one episode or manic episode only may be considered as bipolar 1 disorder. So for an example, let us consider, strawberry as an example, our client. Strawberry. So Strawberry experienced a manic episode. I give different names, all these funny names or fruit names or animal names or pet names, because I don't want to disclose any human names. That's why, that is the reason. So um uh, s- the Strawberry experienced a manic episode where she had excessive energy, engaged in risky behaviors like reckless spending. That means shopping for things which are not even required, reckless shopping, and had little need for sleep. And risky behaviors like reckless driving, and she was overly elated, and this was followed by a severe depressive episode as well, marked by persistent sadness and suicidal thoughts. So she had depressive episode, but this may or may not be present in bipolar 1 disorder. So this is the first example, or the first type is bipolar 1 disorder. And bipolar 2 disorder, what is bipolar 2 disorder? Is it is This bipolar 2 disorder is by recurrent depressive episodes. This is caused by recurrent depressive episodes and at least one hypomanic episode. That means a less severe form of mania. So for example, patient named Apple, let us consider our client as Apple went through periods of deep depression. Here in the first bipolar 1 disorder, there is mania as a prominent symptom which lasts for 7 days. Here in bipolar 2 disorder, there is recurrent depression, depressive episodes, and at least one hypomania. Hypomania means a mania with a lesser intensity, that is hypomania. So, here our patient Apple went through periods of deep depression, losing interest in activities he once used to enjoy. In between, he had hypomanic episodes where he was highly productive and outgoing. This is in the same person, but he didn't experience full blown mania. Here there might be a doubt that at times we also feel very much elated, and in normally as well also we feel sometimes very much elated and happy, and sometimes we also might feel a little bit sad or depressed. What is the difference then? Difference is the duration and the impact. It might not impact our daily routine, it might not impact our relationships, it might not impact our productivity. Here it is impacting. And then the duration as well, duration and the intensity as well. Duration is for us, for normal human beings, the sadness may not persist for more than 1 or 2 hours or more than 24 hours. Here it is for 7 days, right? And the elated feeling we have, the energetic feeling, and the overindulgence feeling that we have is may not also last for longer duration. So the intensity and duration and the impact, all the three matters. Then it is decided as bipolar disorder, because in normal human beings also, we also are sometimes happy, we are also are sometimes sad. So this is the difference. Okay. So, here in the bipolar 2 disorder, as I said, there may be recurrent depressive episodes here, and at least one hypomanic episode, at least one hypomania. That means lesser intensity than a mania. So, here our client Apple went through periods of deep depression here. This is an example. Losing interest in activities once he used to enjoy. He loses self confidence, he may have low self esteem, and he had hypomanic episode as well, where he was highly productive. The same person where he was experiencing depressive episodes, he also experienced an hypomania episode where he was highly productive, highly outgoing, but didn't experience full blown mania. Full blown mania in the sense, he didn't experience the risky behaviors, or the substance abuse thing they do, or they entering into a bad habit phase, a trap of bad habit, etc. That is bipolar 2 disorder. Now there is another type of bipolar disorder which is called cyclothymic bipolar disorder. What is cyclothymic disorder here is, cyclothymic here involves numerous periods of hypomanic and depressive symptoms both. Here in uh, thymic, there is numerous episodes of both hypomania and depressive symptoms that do not meet the criteria for mania or depressive episodes. So this does not meet the full criteria for mania or depression. So both he will have hypomanic episodes, that is means the intensity will be less, it is not very severe. So cyclothymic here involves numerous periods, not one, numerous periods of both hypomania and depression, both the hypomanic and depressive symptoms that do not meet the criteria. That means there are no severe symptoms here. That means there are mood swings. There are cycles of mood swings, but the intensity is not severe. So that means this is somewhat easily treatable, you know. And here our, let's consider our patient is peahen. So peahen mood fluctuated regularly with periods of elevated energy and sociability, followed by times of irritability and sadness. These mood swings persisted for more than 2 years. So here the symptoms, as the symptoms are not severe, it is not diagnosed early. So what happens is, here in our peahen's case, the mood fluctuates regularly. So she has episodes of elevated energy, elevated productivity and sociability, followed by the same day or the same and the next day, followed by the times of irritability or sadness or loss of self confidence, low self esteem, and no interest in doing things. So these mood swings, what happens is, this persists for more time, that means more than 2 years this cycle happens. Because the severity is not so much, the client and the family members will not get to know it very early. They'll think this is normal, this is the normal of this person. So this is called cyclothymic bipolar disorder. And see, there is one more thing called bipolar disorder not otherwise specified. That means this category will include cases that that will not have the significant mood swings. So there is no significant exchange matlab cycle in the mood swings. That means the mood swings are haphazard here. Let's consider a our client as cat. So cat experienced mood swings but did not meet the specific criteria for bipolar 1 or 2. Matlab, there is no intense mania for 7 days, or there is no intense depression as in bipolar 1 and 2. So his symptoms were disruptive to his life, but what impacted was his daily routine and his relationships, his productivity, his personal life and professional life. This was impacted. So this is described as bipolar but not specified bipolar. This is unspecified bipolar. So there is something called next other specified and unspecified bipolar. So related disorders. So what happens here is, these categories here encompass cases where the symptoms of irritability but did not meet the exact criteria for any specific bipolar subtype. It is not cyclothymic, it is not bipolar 1, it is not bipolar 2, but still this is unspecified bipolar because there are extreme mood swings, but the mood swings are usually haphazard. It might be 2 3 episodes of mania followed by 1 episodes of depression, or 3 4 episodes of depression, or 1 episodes of mania and depression, or for many days it is only the depression and then followed by a episode of mania. So this is not specified. So This occurs, and here our patient, let us consider vanilla. So vanilla had mood fluctuations and periods of irritability, but did not meet the exact criteria for any specific bipolar disorder subtype. So still she received the treatment, the psychotherapy and the treatment, but it is not specified. So these are, types of bipolar disorder. See, it's very important to remember that bipolar disorder can manifest differently in each and in every individual, and diagnosis should be made by a, qualified healthcare professional. So if you see any of you and your family members or your friends or colleagues experiencing, or these symptoms, these extreme mood swings, you can, go to a mental health professional. Do not hesitate to go to a mental health professional, because we do not hesitate to go to a doctor when we have a headache or abdominal pain or fever. It is taken very normal, because we are human beings, we have this. So in the similar way, the mental health symptoms should also be taken as normal, and you should approach a mental health professional. And on the based on a thorough evaluation of symptoms and their impact on daily life, appropriate treatment, which may include therapy, medication and lifestyle adjustments, can help individuals manage bipolar disorder effectively and make them to lead fulfilling lives. So after this, now we're going to understand what is a full cycle of, bipolar disorder. How does the episodes look like, with some examples? What is the full cycle? What is the extreme mood swings that is seen in the same person? So as I said yesterday also, this is not split personality or something. This should not be confused with schizophrenia. So bipolar is different from schizophrenia. Okay. Next, see, we'll discuss first case study. See, let's consider our client as here vanilla. So, vanilla has bipolar I disorder. We are discussing of bipolar I disorder. See, bipolar I disorder, as we said, they will have continuous manic episodes with one depressive episode. So, she is here, vanilla is a 28-year-old woman who has been experiencing bipolar I disorder. She had her first manic episode when she was 22 years old. So 6 years ago, she had her first manic episode. What happened then? Vanilla's manic episode lasted for nearly 2 weeks. 2 weeks she was elated. 2 weeks, she was overly confident, overproductive, overly social. During this time, she exhibited the following symptoms here. So, what happened in her manic episode exactly? So, mania. So, elevated mood. So, Vanilla had an unusually elevated and euphoric mood. She felt invincible and believed that she could accomplish anything. In the mania phase, this is the thing. Usually there is elevated mood and decreased need for sleep. Yesterday only we discussed this. In either ways, there is this decreased disrupted sleep. But in mania, it is decreased sleep, and in depression it is increased sleep. That is hypersomnia. Here it is insomnia, there it is hypersomnia. So she slept for only for a few hours each night, but felt energized and didn't feel the need to take more rest. So she slept, Vanilla slept only for a few hours each night, but she felt very much energized, and didn't feel the need for some more rest. So her sleep was disturbed here. Then rapid speech and racing thoughts. This also we had talked about yesterday. So Vanilla's thoughts raced. That means she was continuously thinking of something, so many thoughts in her mind, that will make her, that leads to a confusion, and that will not let her to concentrate on one task. She talked non-stop. What happened due to this? Some people, what happened in some people, there are only thoughts. Here she also talks non-stop, often jumping from one topic to another. But she's not concentrated on one topic. She'll be talking one topic and then suddenly she'll go to some other topic. So impulsivity. See, impulsivity is she engaged in reckless behavior such as excessive spending sprees, shopping, risky sexual encounters, and impulsive travel plans as well. So, and then irritability. When she was generally euphoric, see why irritability? There is decreased sleep and increased, very much increased activity. So the person becomes irritable. She could become irritable and agitated when her desires were thwarted. So something of what she thought, if it did not happen, she became irritable very quick. Then what happened after the this 2 weeks of mania episode? She had depressive episode, that is manic episode. After the manic episode, Vanilla experienced a severe depressive episode. This also lasted for several weeks for her, unfortunately, which was characterized by persistent sadness. That means she felt extremely sad, hopeless, and lacked interest in usual activities. Fatigue and sleep disturbances. She was, Vanilla had trouble sleeping because, she always felt tired and she was always, on the bed. So she did not wake up from the bed, but still she had difficulty sleeping because she experienced overwhelming fatigue. Fatigue, that means tired. She felt overwhelmingly tired all the time. And she had lost her appetite. So she ate very less. Her consumption became very less. She was not interested in eating. So she also lost some weight here. And feelings of worthlessness. And she was not doing anything, so she thought she was she had, and she was avoiding social gatherings and etc, all those things. So she had low self esteem. She felt she was worthless. She felt she was guilty about her actions, and she was feeling guilty about her actions during the mania phase as well, manic phase as well. So, and finally at some point she started experiencing suicidal thoughts, but she did not act on them. Matlab, she did not self harm, or she did not pay so much attention to it. Though she got some suicidal thoughts, she did not act to them. So here, Vanilla's bipolar I disorder involved significant mood swings between manic and depressive disorders. So impacting her work, what all got impacted? Her work got impacted, her relationships got impacted, and her overall well-being was impacted. And then she sought treatment for that. We'll discuss the treatment aspect maybe in the next session, the psychotherapy aspect mainly. And she also took some mood stabilizers, and majorly psychotherapy, that is talk therapy, and support groups to manage this her condition effectively. This is one example of the full cycle. Whatever happens, this is one full cycle of bipolar I disorder. Now we are going to discuss another case study. So let's consider Apple as our second client. See, Apple is experiencing bipolar II disorder. Apple is a 35-year-old man here, diagnosed with bipolar II disorder. So what happens here? He experiences hypomania. Here the mania is not intense. That is, manic episode is not intense here. Right? Here it is, there is hypomania and some depressive episodes as well. We'll discuss. So what happens in here is hypomania episode. See here, Apple's hypomaniac episode lasted for about a week and included elevated mood and increased energy. Here also he had elevated mood and increased energy. Like Apple felt more energetic and confident than usual, and he had increased productivity. He was highly productive at work and took on extra projects here. And social engagement, he became more sociable and he attended social events and he made new friends here. And racing thoughts, he also had racing thoughts means one after the other the thoughts are racing in mind. That means he's not having only one thought, he's having several thought, he or she, whoever is experiencing. Here in our case it is apple experienced racing thoughts but did not lose touch with reality. But this is not mania, matlab this is not a manic episode, this is hypomanic episode. So in hypomanic episode the intensity is not severe, so he could manage. Next it was followed by depressive episode because the depression is more here. So following the hypomanic episode, Apple entered a depressive episode. That means profound sadness. What happened here? It started with profound sadness. See, Apple felt profoundly sad, had a sense of hopelessness, and withdrew from social activities. Here there is hypomania and depression is severe. So he had, profound severe sadness and sense of hopelessness, and he was not at all socially engaged. He withdrew from all social activities, and he had sleep problems. Here Apple had difficulty falling asleep and experienced frequent awakenings during the night. Here also he had difficulty falling asleep, and he experienced he did not have basically a sound sleep. His sleep was disturbed. He was frequently getting up during the nights, and the appetite changes. He did not overeat here. He had no appetite at all, and he had very low energy. That means he also felt constant feeling of tiredness here. Apple had low energy levels and found it challenging to concentrate on tasks. So Apple's bipolar 2 disorder involved cyclic episodes of hypomania and depression. So, but unlike bipolar 1 disorder, he did not experience blown mania, that is full blown manic episode. He received treatment, he received psychotherapy, he received some mood stabilizers, and some support groups therapy, and then he was able to improve his quality of life. See, these case studies illustrate the range of symptoms and episodes associated with bipolar disorder. What all might happen, this is just to give you an idea that what all might happen in bipolar disorder, from maniac highs to depressive lows. So what will happen in manic highs to depressive lows? So proper diagnosis and treatment are essential to help individuals. Okay, and what is done is, psychotherapy or talk therapy is crucial component in management of bipolar disorder. What happens is psychotherapy helps individuals better understand their condition, manage their mood swings, and develop coping strategies. So several types of psychotherapies are used in treatment of bipolar disorder, because every type of psychotherapy or talk therapy has its unique approach. So we'll discuss in detail about what all psychotherapies are used in bipolar disorder in the next session, or in some coming session. So if you have any doubts or any questions on bipolar disorder, uh, please let me know in the comments section, and let me know of what you feel of my sessions. And if you want, and I have started personal coaching sessions on emotional metamorphosis, emotional intelligence, and emotional freedom. And for some concerns, people had approached me for some special one-to-one mentoring, so I've started that. If you also want to enroll into those, please mention in the comments section. So and that's it for today. if you want me to discuss anything, any topic related to mental health or Ayurveda or Ayurvedic psychotherapy or psychotherapy or therapy for mental health or related aspects in general, let me know in the comment section. So thank you for staying tuned and namaste.